come back to Accra and talk about COVID-19. Today on Frontline, we discuss a medical doctor at one of the isolation centers in Accra who has been assaulted by 3 COVID-19 patients. According to police, the 3, Jibril Abimbola, age 23, a photographer, Ahmed Akimbi, age 25, and a musician, and Ramsey Omwefe, age 24, a designer, assaulted the medical officer without provocation. Police investigations indicate the doctor, while on his daily routine checks on patients on the COVID-19 center, disclosed to the 3 suspects who had also been quarantined that their COVID-19 status was positive. One of the 3 suspects, Jibril Abimbola, who was incensed by the revelation, began vilifying the medical officer. Let's get more on this one because Dr. N.S. York, who is a consultant physician and chairman of the Greater Accra Division of the Ghana Medical Association, joins us. Doc, I'm grateful for your time. Let me start with the condition of the doctor now.
Thank you, Asha, for having me on the show, and good afternoon to your listeners. I can, report that as we speak, the affected doctor is healthy now and back to work. Luckily, he had to seek medical attention, and after going through for a couple of days, he's well and back to work. So I can report that it's okay now.
What can you tell us as far as this assault is concerned? What do you know?
Yeah, I think the fact is, as you narrated, so these were people who had arrived by air, and routinely they are screened, and some of them, you get tested positive, and you undergo mandatory quarantine or isolation for a couple of days, and then you are retested. If you become negative, you are released to go. So it is on one of these rounds that the doctor broke the unfortunate news to them, but I don't know what triggered it. But they were happy to hear the negative news, and I'm sure they were thinking negative for them to be released, and that is understandable. But they got incensed and attacked him physically. Somebody restrained him, wanting the other person, to come and attack him again. But luckily, he was able to free himself and run to the police. And fortunately, the people were accosted, and the rest is history. So, but we take exception to that. And this thing should not be allowed to continue. Day in, day out, we hear stories of doctors and health workers being attacked left, right, center, during the line of duty. And it's like a policeman, if they are trying to, ensure peace and you attack the policeman who is on duty. And we've had it. The same thing should happen to persons who attack doctors and health professionals whilst they are on duty. We are happy somehow that justice was safely, done. However, we thought that they could have done, gone a bit further than what was done. Beyond the fines, we think that, they could probably have asked the people to offer a public apology and admit publicly that what they did was not good, so that it serves as a deterrent for somebody else who may be planning similar things in the future, so that doctors would work knowing that nobody will attack them whilst they are doing their lawful duties.
I'm happy that you mentioned that this is not the first time it's happening, because day in, day out, you hear people reporting about this. But what engagement have you had with the Ghana Health Service, for instance, the Ministry of Health? I mean, all those that matter, to take steps in ensuring these things do not happen to the doctors?
Well, we have had initial discussions with both the Ghana Health Service and the ministry. And, some of these things lie solely in the purview of the law enforcement agency. What the employer can do is to provide a congenial atmosphere for you to work in and deliver your best. But when it transcends that and it goes into issues of security and personal safety, beyond what the hospital or the ministry or the Ghana Health Service can provide, at the least, when it comes to enforcement, it's the police. And I think they were up to their duties, but we were thinking that in consultation with the courts, they would have gone further, so that harsher punishment would have unleashed onto these miscreants. I call them miscreants, so that it will serve as a deterrent for persons who may want to do the same in the future. The doctor is already stressed from the effect of the pandemic, having not to sleep for several because we are working extra hours, to lack of motivation and all. And then if somebody knows that if I work under these circumstances, I may be attacked further physically on that point, not just verbal. I think they are quite, not sure what is awaiting them. So this thing should never happen again.
Are there internal mechanisms, at places of work to check this? Because, these cases can really dampen the morale of the frontline workers.
And you couldn't have said it any better. Yes, it really dampens the morale of the health workers. But at the regular hospitals and clinics, I dare say that the hospital have their own internal security, which are deployed to take care of some of these things. But remember where this still happens. It's M Plaza, it's a hotel. So they may not have the regular security you may have at the regular hospital. I know that there's some patrol there. But these things can also happen within a twinkle of an eye, and this is exactly what happened. So we would urge the ministry and the Ghana Health Service to increase securities at these treatment centers so that such incidents, even if they will happen, will be nipped in the bud. And I will also call on my colleagues and all professionals at this stage to exercise restraints, even in the phase of provocation, so that even when they are provoked, either verbally or physically, they are able to hold themselves. This is a calling that we all have been called to serve under, and that we should be protected. So those who ought to protect us must protect us. And I assure you that this is a setback. The doctors and the health workers are still ready to serve. We are just saying that it should not happen again. And when it happens, severe punishment should be meted out to the miscreants. I therefore.
I'm grateful for your time. Dr. Ernest York is chairman of the Greater Accra Division of the Ghana Medical Association.